Hi, this is Ray Watkins, and I'm with my participant Anita here, and we're going to our pre-activity screening here for class. So what we're going to do is we're going to start off with some resting measurements and some anthropometric measurements first. So our first resting measurement is going to be a heart rate. So what I'm going to have Anita do is sit here nice and relaxed, make sure that your feet are not crossed, and we're going to check for her radial pulse here. So I'm going to place my two fingers here, and I'm going to count how many beats that I feel for 30 seconds, and then we'll get her resting heart rate. Ready? And all right, we have 45 beats in 30 seconds, which gives us a resting heart rate of 90 beats per minute. Next resting measurement, we're going to be taking Anita's resting blood pressure here. So what we do is we have our adult large cuff here, and this is index line is lined up with the antecubital space. And what I'm going to be using is my stethoscope here to be hearing for the coracough sounds at a brachial artery here. We have a blood pressure of 115/75. Okay, so next what we're going to do is we're going to take some body composition measurements here. We're going to do a 3-site skin fold test with Anita. So our 3 sites that we're going to assess, they're going to be all on the right side. We're going to do a tricep measurement, a suprailiac measurement, and then a thigh measurement here. So the first one we'll do is the tricep. So we'll come right on over here, and what we're going to do is we're going to measure for the midpoint. Nice and relaxed. Thank you. Midpoint between the acromion process and the olecranon process on the right side here. So we have a measurement of 12 inches, so 6 inches is going to be our point right here. So with this tricep measurement, we're going to do a vertical fold. And we have our measurement right here of 26 millimeters. Go ahead and let the skin rebound, and then we'll do this one more time. Again at 24 millimeters. So we have two 24 millimeter measurements for the tricep. Next, what we'll do is a suprailiac measurement. So I'm going to be palpating for the anterior superior iliac crest of her hip right here. And then what I'll do is I'm going to take a diagonal fold. Take this measurement here. And we also have a measurement of 23 millimeters. And we'll do this one more time. Anterior superior iliac crest, 2 centimeters towards the navel here. Diagonal fold. And a measurement of 23 millimeters again. And then lastly, what we'll do here is we're going to take a skin fold measurement on the thigh. So what we're going to do is we're going to find the midpoint between the inguinal fold here and the patella. That's going to give us 14 inches. So 7 inches is going to be our midpoint. So I'm going to have Anita slightly flex her knee, relax just a bit here. We're going to go ahead and take a skin fold measurement here. And this measurement is 25 millimeters. Relax, and we'll do that one more time. Nice and relaxed with that knee. Thank you very much. Our last measurement here, 25 millimeters. Thank you. So we're all finished with the body composition analysis there. Okay, the next section of our assessment is going to be some girth measurements here with Anita. So we're first going to take her waist measurement, and this is going to be the narrowest point between the xiphoid process and the umbilicus here. So Anita, I'll have you go ahead and stand with both feet together. There you go. Place your arms right out there. Very good. So I'm going to take my Gulick tape measure here. Again, looking for that narrowest point between the xiphoid process and the umbilicus. And we have a measurement of 37 inches. Stay and maintain that position, Anita. Thank you very much. We'll do this one more time. Applying light pressure to the Gulick tape measure, 37 inches. Next, what we'll do is we're going to take a hip measurement. So Anita, I'll have you maintain this position here. And now this circumference measurement is going to take into account the gluteal fold here and come right around to the waist. And this measurement is 41 inches. I'll have you maintain that position right here. Nice and relaxed. And we'll do this one more time. So making sure that we encompass the gluteal fold into our circumference measurement. Bringing that over again to 41 inches. So our next section of our assessment here is going to be our flexibility assessment. This is really key to look for range of motion with our participants and also helping to set some baselines for flexibility training here. So Anita here is going to be performing the sit and reach test, which is going to focus on the hamstring and lower back, lumbopelvic rhythm range of motion here. So how this is set up, we have her feet here at 15 inches, and then she's sitting up nice and tall. So what I'm going to have you do, Anita, is I'm going to have you take a nice gentle breath in. You're going to exhale out, keep both fingertips together, and I want you to touch the farthest point on this tape measure for me. And we're going to do this 2 times, okay? All right, first one here. Nice inhale breath, exhale nice and easy, reach to that farthest point and touch, and touch. There we go, and relax. All right, so we're going to do that one more time. Nice inhale and exhale with both fingertips touching. And we have 9 inches. Very good. Thank you very much. Okay, we're moving along here with our pre-activity screening. And what we're going to do now is we're going to look at some more range of motion, but this is going to be joint specific. So we're going to use Anita's left side here, and we're going to start off with measuring her shoulder flexion. So I'm going to be using the goniometer right here. So what I'll do is I'm going to be placing the fixed arm right down here. I'll start at the acromion process. This is going to be the midpoint of my fixed arm. And then Anita, I'm going to have you keep your arm nice and straight, and I'm going to have you flex that arm as far as you can back towards the ground here. And go ahead. I'm going to have you with your arm straight. Go ahead and bring it all the way up as far as you can this way. There we go. So this movement arm is going into the lateral epicondyle of the radius here. And we have our measurement here of 153 degrees. Okay, next we'll be moving, staying with the arm, but we're going to be measuring elbow flexion here. So the fulcrum point is going to be here in that lateral epicondyle of the radius or the humerus here, and we're going to fix our fixed arm right here, straight down, going towards the wrist. Now I'm going to instruct Anita to go ahead and flex your elbow as far as you can, bringing it towards you. Very good, as far as you can. All right, and then with our movement arm, keeping this here, using that outside wrist measurement here, and this gives us 134 degrees of elbow flexion. Okay, next we'll be moving down the body here towards the hip. So what I'm going to do is I'm going to use my fulcrum point. It's going to be on the left side here, We're going to be using her left hip measurement here. So the fixed arm will be right here, starting at the. Go ahead and stop. We're moving down the body here. We're going to look at hip flexion here. So I'm placing my fulcrum point at the femoral acetabular joint. So that's where my fulcrum will be. My fixed arm is going right down the line of the leg. I'm going to instruct Anita to keep her leg nice and straight and go ahead and bring her leg up as far as she can, actively, without pain. And we're placing the movement arm right in between that femoral acetabular joint to the lateral epicondyle of the knee, and go ahead and relax for me here. And that's going to give us about 62 degrees of hip flexion. And then lastly, I'll have you go ahead and turn on over for me, Anita. And we're going to look at knee flexion here. So continuing to stay on her left side, using that lateral epicondyle of the femur here is my fulcrum point. I'm going to have my fixed angle right against the leg right here. And what I'll do is I'm going to instruct you, Anita, to go ahead and flex your knee as far as you can. That's it. And then we're placing this movement arm here between that lateral epicondyle and the lateral malleolus of the ankle. And that's going to go ahead and give us about 102 degrees of flexion. Okay, so we're moving to our next section of our pre-activity screening here. And we're going to be testing some upper body muscular endurance with the push-up test here. So I'm going to demonstrate to Anita the proper form and technique, and then she'll go ahead and perform this test. So what I'll have you do is I'm going to have you start with your knees just how they are right there, keeping your hands underneath your shoulders, feet in contact with the ground. So what I'll have you do is you're going to lower yourself so that your chin makes contact with the ground, and then all the way back up, extending the elbows. That'll be one repetition. We're going to see how many consecutive repetitions you can do without stopping. All right? If you feel any pain or discomfort, feel free to let me know and we'll stop the test. Does that sound all right, Anita?
Yes.
Okay, so I'll have you go and bring yourself forward just a little bit here. I'll have you bring your hands forward here. That's it. Now, some common things that we see is a low back arching here. We may get some tilting. And then for testing purposes, we really want to make sure that Anita comes all the way down and makes contact with the mat with her chin and fully extends back up. So, I'm going to have you scoot your hips forward just a bit. Perfect. Now in that position, you're going to go ahead and flex your elbows, and we're going to see how many of those push-ups you can do without stopping. You ready?
Yes.
And go. I'm going to need your chin to touch the mat. And we'll stop right there. Very good. 8 repetitions. Great job, Anita. Great job. Okay, our next test in our testing battery here is going to be for muscular endurance, especially in the core muscles here. So I'm going to demonstrate the starting position we want for this partial curl up test. So I'm going to have my participant Anita start lying flat on her back. Feet will be on the ground flat, knees bent at about 90 degrees. Her fingertips will be at the top of this tape line here. And because she is over 45 years of age, we've made the length of the tape 8 centimeters. So what you'll do is you're going to start in this position right here, and to the beat of a 40 beat per minute metronome, I'm going to have you raise your head and shoulder blades off the ground so that your fingertips slide to the end, 8 centimeters, and all the way back down. So every other beat will be a repetition. 1 and back. All right, does that sound doable, Anita?
Yes.
Okay. So I'll have you come on over and get into that starting position for me. That's it. So I have your feet flat. I'm going to have you scoot back a bit so that when your arms are straight, Your fingertips are at the top of this line right here. Very good. So knees are at about 90 degrees, feet are flat here. Okay, so what we're going to do is we're going to see how many times she can do this partial curl up, continuing with the rhythm of the 40 beats per minute metronome. Now, if she falls off rhythm, we will stop the test, or if she voluntarily stops, we will stop the test as well. All right, so are you ready, Anita?
Yes.
Okay, ready?
Yes.
And go. So you're going to push so that your arms extend to the next. And go. Back. And stop for me there. Thank you very much. All right, so we finished our testing battery here, so we're going to get some post-testing measurements of heart rate and blood pressure with Anita to finish this up. So we're going to start with her heart rate. So I'm going to have her seated, making sure her feet are not crossed. I'm going to palpate for that radial pulse right here. I'm going to give a 30-second count and see how many beats we have. Stop. So we had 47 beats per minute, which is going to give us a total heart rate of 104 beats per minute. Okay, and then next what we'll do is we're going to go ahead and take your blood pressure here. So we're going to go ahead and line up the blood pressure cuff with that antecubital space here. And I'll be using the stethoscope here, listening for the Korsakoff sounds in the brachial artery. All right, and so what we do is we have a post-testing heart rate of 143/92. Thank you very much.